Welcome back, everybody, and thanks for listening. Now, imagine for a second that you're a car. You're in top notch shape because you just came off of the assembly line and you're fresh out on the road. At this point, all your gears are lubed, all your mechanics are functioning appropriately, and you're like I said, you're in top notch shape. And now with time, you need some repairs, you need maintenance and upkeep. That's to be expected. But with proper maintenance, it's very likely that you'll have a great ride longevity, and you'll even probably have a really good driving experience for the majority of the time that you're on the road. Occasionally, situations will come up like car accidents or maybe accidentally putting in, bad quality gas, that might make it so that you need some additional repairs that you hadn't planned on. But because you've been taken care of so well, again, oil changes, changing tires, spark plugs, and things like that, you'll probably recover your functionality pretty well. You'll get back on the road. You'll still have the great performance. But imagine if you hadn't been maintained. Imagine if your owner or the person maintaining you didn't change your oil. They didn't put new tires in. Imagine you burn out all your spark plugs and your brake pads are bad, right? And now you get into this accident, or now you put in the bad gas. It's highly likely that you may not recover as well as a car that has been well maintained. Now, your body is this car, and exercise and a balanced intake are the maintenance that you need to make sure that in those unexpected events that you improve the likelihood that your functionality and performance will come back. So today we're going to talk about exercise and anesthesia, because a few weeks ago, probably a month and a half ago, I put a survey out and didn't get a whole lot of responses, but that's okay. I got enough to keep going about what you wanted me to talk about next. And the number one response was talking about exercise and anesthesia. And I think this is a pretty short topic compared to some of my others because it kind of makes sense, right? But just to give a little bit of details, because again, I like to use evidence-based, and I like to use data to help you to understand why your doctors and healthcare professionals are asking you to do all these things. So exercise, when it comes to surgery and anesthesia specifically, does 4 things. It improves your cardiorespiratory fitness, and I'll talk about that in a little bit more detail in a moment. It improves lung volumes, so how big of a breath you can take is greatly improved when you regularly exercise. It improves oxygen transportation, and again, why all these things are important, I will explain momentarily, but you are better at moving oxygen throughout your body. And it improves the efficiency of the engine factory of your cells, and it's called the mitochondria. And if you click this link here, there's a really great short cartoon that's been made by someone that explains more about what the mitochondria does. But all of this leads up to the oxygen and the cardiovascular functionality leads to getting the mitochondria in your cells oxygen, and they are the things that create energy for your body to function. There's a direct relationship between aerobic exercise capacity, meaning how much aerobic exercise you can do, and improvements in mortality, morbidity, and quality of life. And I'll explain the difference, especially between those first two. Mortality is how likely you are to die depending on an inciting event, right? So in this case, we're talking about surgery. In another case, it may be talking about some other illness, the flu or meningitis or COVID-19. So the likelihood that you will succumb is your mortality, how likely you are to die. Morbidity, however, is how likely you are to have some bad outcome, functional outcome from this thing. If you break your toe when you have diabetes and you have neuropathy, let's say, you don't have really good blood flow to the periphery, to the outsides of your body, your morbidity is higher than someone who doesn't have diabetes, because it's more likely that you will have complications from that event. And then again, quality of life is pretty self-explanatory. And I don't want you to confuse exercise capacity with weight, because I know that's a very important social, emotional, cultural topic right now. But I'm not equating the two. Obviously, on the extremes of either of those, extreme overweight and extreme underweight, it kind of makes sense. But in the middle, there's too much, new data coming out. I mean, how much physical exercise can you do? Not your size. Let's keep going here. So why is all of this important? So we talked about the oxygen. Every minute that you're sitting down, you are consuming oxygen, you're breathing. And this is so that your body can make energy to keep your heart pumping, to keep your pancreas secreting insulin, to keep your bones are constantly turning over. Every cell in your body is constantly breaking down and being remade. You are constantly being remade. There are very few things in your body, if you're an adult, that you have now that you had when you were first born, or at least repaired on. So that requires energy. And while you're sitting there, let's use the number 3.5, because that's, if you look kind of in traditional medical education, 3.5 milliliters of oxygen per minute per kilogram of body weight is how much you're using per minute. And let me break that down to you. If you have a man that weighs, let's say, 185 pounds, which means he's about 84 kilos. So if he's sitting down and we're saying his metabolic rate at that point is 3.5 mLs per kilo per minute, that means that every minute his body is consuming somewhere around 294 mLs of oxygen. It's all to say that there's a standard amount of oxygen that you just need just to live. Now, if that man were to stand up and run up the stairs or run down the hall or have surgery, any stressful event, his body's going to need more oxygen to provide more energy to either make his muscles move faster or to repair a wound. If you go into a surgery and your body isn't used to bumping up its meeting the metabolic demand that your body is requiring, it's more likely that you're going to suffer some sequelae from that, or consequences from that. So the way that your body's going to get more blood to your muscles when you run, right, is your heartbeat is going to beat faster. And actually your heart is going to squeeze more blood. If you have a stifled, deconditioned cardiovascular system, it's not going to take much for your heart rate to go up. It's not going to take much for your heart to kind of get tired, because you haven't used it and adapted it to those immediate changes in stress and need. The same thing can be said for your lungs. When you're running down the street, jogging or what have you, you take bigger breaths and you take more of them. It requires energy to do that. So your lungs get bigger because your chest wall stretches out. Your diaphragm, which opens up your chest wall, is this flat muscle down at the bottom of your thorax that contracts and makes your thoracic cavity get bigger. Those are muscles that need energy to move. If you are deconditioned and you are not is able to provide your body with that extra blood flow when it needs it, those muscles will tire out. Or what will possibly happen is that you won't supply enough blood flow or oxygen to those tissues and they begin to die. Because remember, the oxygen is providing energy for the cell to function. If you don't give it oxygen, it can't function, it will die. And that's what happens with the heart attack. There's some insult to the heart where a blood vessel is blocked and blood can't get to a patch of tissue in the heart, the muscle of the heart. And those tissues are very, very metabolically active in your heart, because your heart is the muscle that constantly goes from the day you're born to the day you die. It needs a lot of energy. If you block off energy, it doesn't take very long for those muscle cells to die off. And that's what a heart attack is. And the same thing happens with your brain. Your brain is very metabolically active. So short momentary losses of blood flow and thereby oxygen delivery can have very serious and quick consequences to those cells in your brain. The improvements in the overall patient experience of a surgery is broken down into 4 areas that have to be avoided in order for there to be a good experience. The first thing is avoiding readmission after surgery. So what we want to do is we want to get you through the surgery and get you out to rehab or home. And we don't want you to come back, because if you come back, something bad has happened and it's going to cost money and time and pressure on you and your family to deal with these consequences. And some of the reasons patients are readmitted to the hospital after surgery: infections to the site, pneumonia, pain management issues are a big reason why patients come back. GI problems, surprisingly, for patients don't really think about this when they have surgery, but nausea and ileus. And ileus is when your bowels, your intestines just stop working. From insult from surgery or even narcotics that can slow your bowels down. Those issues will bring patients back in the hospital after surgery. Blood clots bring patients back in. So in your legs, if the blood clot from your leg travels to your lung, that's called a pulmonary embolus, or a PE, and that will bring patients back. All of those things are improved with better physical conditioning before surgery. The other things, we don't want complications, again, that we've talked about already. So wound infections, and lastly, length of stay in the hospital. So when you come back into the hospital, or when you after you have surgery, not everyone stays, but the patients who do stay, if you're better physically conditioned, you are more likely to go home faster. Again, this translates to saving dollars and to saving you and your family the hardship of dealing with you in the hospital and getting you home and getting you back to being healthy as quickly as possible. Some statistics, because you know I like statistics. There was a study out that looked at oxygen use versus mortality. Metabolic equivalents, or METs, are used to measure how much oxygen your body is using at any moment in time, depending on what you're doing and your weight. So we talked about this before, the 3.5. Increasing your metabolic rate at rest. So again, and the number 3.5 is being kind of debated in literature now. As you improve that number, meaning you make it so that your body uses more oxygen at baseline, you're better at extracting oxygen, and you have tissues that have higher metabolic rates, it improves or decreases your mortality by up to 10 to 25%. So even 1 MET, going up 1 MET at baseline, improves your overall mortality by 10 to 25%. So 1 MET is when you're sitting at rest and you're not doing anything. The second, 2 METs may be standing up and walking at a normal pace. And it goes up and up and up to like 7 METs, 13 METs if you're running. And they even have METs when you are in the hospital and you're sick. If you've known anyone who's had like sepsis or something like that, that is a very metabolically active scenario for your body to be in, because it's just a huge inflammatory event. Your body's working so hard to try to heal itself. Just getting a little bit more physically active has huge impacts on your survival, your functionality, and your pockets. So the last part I want to discuss is that quality of life that we talked about. So we can talk about, getting you in and out of surgery. And as I've said in plenty of, several of my other videos, that anesthesia is very safe and we can get most people through the surgery pretty safely. But the time after surgery is, I think, what patients aren't really thinking about when they go in until after it happens. Those few hours that you're in with me, I am in control of all those things in your body, and I can manipulate them pretty easily with medications and things like that. But outside of that, your body has to be able to take care of itself, as it's always done. A little physical activity can greatly impact all of us, but specifically you're the one who's getting ready to undergo this procedure. Talk with your physician about something called a prehabilitation program, and there are lots of them around now that the ERAS protocols are starting to come into play in a lot more places. ERAS being enhanced recovery after surgery, and I talked about this in a prior video. But getting you as ready as you can before surgery is gonna what improves your likelihood of really being healthy and recovering after surgery. And some of these programs, especially some of the major abdominal procedures that patients have and joint procedures, they have set up really great physical activity programs that are modified to the patient population that they're dealing with. So if they have knee patients, they're not going to tell you to go out and run, but talk to your doctor about some of those programs. And even on your own, very small changes in your physical activity will have a huge impact on your overall outcomes, on your pockets. So with that, get out there, take a 20 or 30 minute walk, kind of brisk, not a stroll, but keep a good rhythm going on you. If you have one of those cool watches and it keeps your heart rate for you, it'll tell you your heart rate range that you should be in to really get the full benefit of that walk. And then let's see how you do. I think you're going to do great. And it really doesn't require a lot. 20 minutes, 30 minutes, 3 times a week is a great place to start. And who knows, you might start to like it. So we'll see you next time. Thanks for listening.